Tonsil stones, also known as tonsilloliths, are small, hard calcified deposits that can form on the tonsils. They are typically composed of bacteria, mucus, dead cells, and food particles that become trapped and accumulate in the crevices of the tonsils. Tonsil stones can cause bad breath, though they are usually not painful or harmful. They look like little white or yellow pebbles on your tonsils. They are usually small, though sometimes people can get large tonsil stones. Several factors contribute to the formation of tonsil stones. The first one is mucus and saliva. The tonsils are located at the back of the throat or part of the lymphatic system. They contain numerous small pockets or crypts where mucus and saliva can accumulate. Second one is bacteria. The mouth is home to a variety of bacteria, some of which can produce sulfur compounds. These sulfur-producing bacteria can contribute to the full odor often associated with tonsil stones. Small food particles can get lodged in the tonsil crevices, providing a substrate for bacterial growth. Inadequate oral hygiene can lead to an accumulation of bacteria and debris in the mouth, increasing the likelihood of tonsil stone formation. Recurrent or chronic inflammation of the tonsils, often due to bacterial or viral infections, can lead to the development of tonsil stones. Conditions that cause excess mucus production or postnasal drip, such as sinusitis or allergies, can contribute to the formation of tonsil stones. Smoking can lead to the buildup of substances in the mouth and throat that can contribute to tonsil stone formation. Some references believe that certain diets, particularly those high in dairy, can contribute to tonsil stone formation, though scientific evidence supporting this is limited. Tonsil stones are not always symptomatic, and some people may not even be aware that they have them. However, sometimes they do cause symptoms. One of the most common symptoms of tonsil stones is persistent bad breath. This is often described as a foul, unpleasant odor. Tonsil stones can cause irritation or discomfort in the throat, especially if they are large or located near sensitive areas. Larger tonsil stones can make swallowing food or liquids uncomfortable or difficult. Tonsil stones may be visible at the back of the throat as white or yellowish spots. Some individuals with tonsil stones may experience referred pain to the ears, as the tonsils and ears share nerve pathways. In some cases, particularly if a tonsil stone is dislodged and makes its way into the back of the throat, it can trigger coughing. And some individuals may experience a metallic taste in their mouths, which can be caused by the presence of tonsil stones. In cases where these stones are associated with chronic tonsillitis, the tonsils may appear red, swollen, or inflamed. Very large tonsil stones or clusters of stones may interfere with the movement of the tonsils, making it hard to fully open the mouth. The treatment of tonsil stones depends on their size, severity of symptoms, and how frequently they occur. Here are some common approaches to managing tonsil stones. First class of treatment is remedies at home. Like gargling with salt water, this can help to dislodge smaller tonsil stones and reduce irritation. Or using a water flosser. A water flosser can be used to gently irrigate the tonsils and remove debris. For small tonsil stones that are visible, some people use a cotton swab or clean finger to try and gently dislodge them. In cases where tonsil stones are associated with a bacterial infection or chronic tonsillitis, a course of antibiotic may be prescribed. The second class of treatments are medical procedures, like curette or scooping. A healthcare professional may use a special instrument to physically remove the tonsil stones. This is typically done under local anesthesia. Laser tonsil cryptolysis involves using a laser to smooth the surface of the tonsils, reducing the size of the crypts and making it more difficult for tonsil stones to form. In severe cases where tonsil stones are recurrent and causing significant discomfort, a tonsillectomy or surgical removal of the tonsils may be recommended. This is usually considered the last resort. Maintain good oral hygiene by regular brushing, flossing, and use of an alcohol-free mouthwash can help reduce bacterial growth in the mouth. Drinking plenty of water can help prevent the buildup of bacteria and debris in the mouth. And finally, some individuals believe that modifying their diet, such as reducing dairy intake, can help prevent tonsil stones. However, scientific evidence supporting this is limited.